that will help us understand the real safety and responsibility behind every medication we administer. Today's exhibition is designed to bring pharmacology to life through models, charts, demonstrations, and drug presentations that showcase the fundamentals of medication, their actions, uses, and safe nursing practices. This event aims to enhance our clinical understanding, promote medication safety, and strengthen our skills as future healthcare professionals. Let us begin this day with the Almighty's blessings. I welcome Ms. Chandana and team for the prayer song. Thank you, sir. It is my privilege to extend a warm and respectful welcome to our dignitaries, faculty members, and my dear friends. I'm delighted to welcome our respected founder chairperson, Dr. S.P. Yogannath sir, to this wonderful occasion. We welcome you, sir. We are delighted to welcome Dr. Shilpa Parakshama, M.Pharm, PhD, who is currently serving as Associate Professor and Principal of Pharmacy Practice in the College of Pharmacy, Mysore. We welcome you, ma'am. And indeed, delighted to welcome Dr. Lisa ma'am, HOD and Dean of Santa Mada College of Nursing. We welcome you, ma'am. I also welcome our respected principal, Dr. Nagamani ma'am, Principal, Suyo College of Nursing. And welcome you, ma'am. I also welcome Dr. Sangeeta ma'am, Principal, Suyo Institute of Applied Health Sciences. We welcome you, ma'am. And I welcome each and everyone to this wonderful occasion. To officially inaugurate this exhibition, I respectfully invite our dignitaries and excellencies for the land lighting ceremony. Welcome. I now welcome our founder chairperson, Dr. S.P. Avana sir, to speak a few words. Welcome, sir.
Dr. Shilpa Palakya, Dr. Lisa, Principal Nagamani, and Life College Principal, and my dear students and teachers. I am very happy to inaugurate this pharmacology fundamental principles of prescribing module seminar today in our college. You know, when I am sitting here, my memory goes back to my third year MBBS student days, wherein the pharmacology was my subject to study. You know, when you finish anatomy and physiology and come out to the clinical, the pharmacology, forensic, pathology, and microbiology are the subjects we are supposed to study in MBBS. Among all the subjects, you know, the pharmacology is the most evaporating subject. Very difficult to register the names of the medicines in the cortex. It is a very difficult task. That too, in the same group of drugs, there will be many chemical genetic names. So it was a very evaporating subject. Even now I feel. Do you feel that? Huh? What do you feel? You feel the pharmacology is very easy to study and reproduce in examination? Huh? You are keeping mum. What is your opinion? No. It is a good subject. Oh, huh? So probably cortical cells might have been evolved over these years. See, pharmacology is a very fascinating subject. It is a two-edged weapon because any chemical substance, a foreign chemical substance, if it is introduced to the system, it is just like putting an atom bomb inside. Small atom bomb, chemical atom bomb. Because any drug which is not inside the body, which is kept outside by the creator, is injurious to the health. So therefore, you must be very stingy and careful while introducing this atom bomb to the body. You don't know a drug may have a known effects, positive effects, good effects, and not so harmful side effects. But we don't know beyond that. We can't say it does not have any effect. It's very difficult to say. So there will be some effects which will not be researched. Don't think what all is written in the textbooks, what have been found out are the only effects and side effects of the drug. Beyond that, there may be which we do not know, which may have effects in the long run, even on the genes. So therefore, the first principle is drugs. Using drugs is use the drugs when they are inevitable. This is the first principle you must learn as a clinician, as a doctor or a healthcare personnel. Yes, when the drugs are inevitable, it has to be used. Use them with the appropriate minimum dosage for a minimum prescribed period. Don't play with drugs. When you decide to use a drug, you use them with a prescribed minimum dosage. You must start with a prescribed minimum dosage and for a minimum time. Only when you are not getting the desired effects, then only you must think of increasing the dosage and continuing for still longer time. This is the second principle that you must follow. The third principle is select a drug. When there is a choice to select a drug for the same cause of action, select a drug which has a minimum side effect, maximum good effects. So these are the four principles you must follow when you are using a drug. Because pharmacy is concerned with storing of drugs. So maybe the madam will speak more on the pharmacy. The pharmacopoeia means it is a book containing what are all the drugs and the generic name available is, we call it as pharmacopoeia. Pharmaceuticals means it is an industry which manufactures drugs. So we must remember pharmaceuticals is industries which manufacture the drug. It is a different field. Pharmacopoeia is a book containing all named generic names of all the drugs available. You must use a drug which is in the pharmacopoeia. Never use a drug which is not listed in the pharmacopoeia. Then pharmacy. Pharmacy is concerned with preparation, storage and dispensing. Another most important thing is, as a pharmacist, the storage of drugs is very, very important. You must always follow a prescribed methodology of storage, because if you err in storing of a drug, three things can happen. One, the efficiency may deteriorate. That doesn't matter. The drug may disintegrate, and the preservatives that are used to manufacture the drug, and in interaction with the moisture and all, there may be a toxin produced inside the preserved drug. So therefore, storage of a drug in a pharmacy is very, very important. Never substitute a drug. As a doctor, as a pharmacist, you should never substitute a drug. A doctor might have written one analgesic, paracetamol or diclofenac sodium. If you don't have that, same group of drugs from other category, ketotifen, you should not substitute, because judicious selection of a drug by a consultant involves lot of process, because though the drugs of the same group, they act differently. Though the general mechanism may be same, but there is a little variation in the process of acting a drug, which may be specific for that particular individual. Then, drug interaction. You must be very careful. Nowadays, a modern man takes handful of drugs. I have seen people taking handful of drugs and swallowing. ಒಂದೊಂದು ಬಕ್ಸೆ ಮಾತ್ರೆಗಳನ್ನ ಹಾಕೊಂಡು ಇಟ್ಬಿಡ್ತಾರೆ. So modern man is drug dependent. %90 of the people in the world are taking a single drug. How much? How much? 90% of the people in the around the globe, you go to any country, every day they take one drug. Water baby. And 50% of them taking more than 3 drugs per day. Yes, the pharmacology people should research. This is very important. You should go take up a project in your GSS Research Institute in Mysore. How many people are drug free? How many people are not taking a drug? How many people are taking a drug? It's a very important community survey. Please take it up, please. Huh? So, and therefore in these, because of these multiple drug taking, there may be a drug interaction. Drug interaction. You must be very careful about this. The drug interaction may take in the mouth itself, or in the intestine itself, or in the system. Their metabolites, the drug itself may not interact, but their metabolites may interact. So therefore, because nowadays the practice is multi-speciality. Cardiology doesn't say respiratory. Respiratory philosophy doesn't say gastrointestinal. They have forgotten. Most of our specialists have forgotten that this body acts as a single composite structure having multiple organs. They have forgotten. Very unfortunate about doctors. So therefore, a cardiology patient, if he has got a neurology problem, this cardiologist is not bothered to see what is the drug written by a cardiologist. Go on prescribing his medicine. So also like, if he has got a nephrology problem, he will do write a drug because kidney is a very important source of excretory organ. The burden of excretion of the drug is on 2 important organs in the body. One is liver and another is kidney. So therefore, the drug interaction. So therefore, these multiple drugging and multiple specialties have caused more injury to the patients, prescribing more drugs than good. So with all these things, we have to practice. So therefore, like we, all of you, have put up a beautiful exhibition. I will come in the evening and see. And all the teachers today, we are organizing a seminar on death. Seminar on death. The scientific, spiritual and philosophical aspect of death. Because as a medical healthcare personnel, you must understand death, philosophy of death, spirituality of death, science of death. So therefore, I request all the teachers should be present, at least 2 students, because the hall is not big. At least 2 students, final year students, or intermediate students. 2 batches. 2 students. At least 10 students should be there in the evening. But mandatory all of you should present. So I wish you all the best. Thank you all.
Thank you so much, sir. It's my pleasure to welcome our respected Chief Executive Managing Director, Dr. Rajendra Prasad sir, to this wonderful occasion. Welcome, sir. Rajendra Prasad sir to speak a few words about this. Welcome, sir.
Good morning, all.
Good morning, sir.
Respected people of the dais, teachers, I'm happy to be a part of this program on fundamental principles of prescribing. So, majority of you are final years, no? Second years. Still, you are not going to be question of prescribing drugs. So, but still, it will be useful from the madam. I welcome Dr. Shilpa madam as well as Lisa madam to be a part of taking a class or a program on fundamental principles of prescribing. I would like to share a few things only on prescribing because as a doctor, I am basically a maxillofacial surgeon. We regularly give drugs without even knowing much of, as Dr. Yoganas has told about the drug interaction. Because you always, as a specialty surgeon, like it could be gastroenterology or a neurology or any surgeon physician, we try to prescribe drug depending on the system what we deal with. For example, I deal with maxillofacial area. We prescribe drugs only to cure the disease. We are not worried, as you said, about the dynamics of the drug, what it does with the other. Because majority of the patients, as you said, more than 70% of the individuals are having comorbid state. It is not a straightforward for single disease, majority won't come. Maybe 60 to 70% will have many comorbidities, apart from having a local problem, will have comorbidities. So we prescribe a lot of drugs. But we don't even bother which drug is going to interact with which medication because antibiotic has become a fashion now. Without antibiotic, there is no survival. We don't even know whether it is cured the individual or it's a immunity which has cured the individual. They are two different things. Because every individual has his own innate immunity which is going to cure the disease, apart from the antibiotic what we prescribe. So it is always important to know what we prescribe and time and again this kind of mentors will be there to mentor each student or individuals. So what drugs, how to prescribe because I was working in oncology institute in Kidwal. During those days also I have seen there are multiple drugs in chemotherapy. Wherein hope you all know what is chemotherapy? Yes or no? What is medical oncology? Medical oncology is a specialty wherein we deal with drugs, cancer drugs, because we have separate specialty for surgical oncology, radiotherapy, and medical oncology. Medical oncology is the area wherein we prescribe drugs, wherein what is not available by surgical, we tend to go with medical oncology. And medical oncology will certainly help for to make the things sensitive for radiotherapy. So certain drugs are given. See, because the research is so much vast, they are trying the newer drugs. When it goes for cancer, they are trying a lot of newer drugs. It has become a business now to give a newer drugs. Because research is so much in the field of medical oncology, they have made it to a kind of business than an individual concern. So I would recommend them to also talk about anything that's related to medical oncology also. Because medical oncology is so vast wherein the drugs can cause drug interactions. The individuals will suffer apart from the real-time primary tumor. It is going to damage the other blood cells. So we should be very careful whenever we are prescribing drugs as a sister or as a clinician. It is very important. So hope take-home message will be very clear with both the teachers. They are going to guide you in a better way. Take the good principles and carry forward for the better thing. Thank you.
Thank you so much for a very good word, sir. We are delighted to welcome Dr. Shilpa Paraksha ma'am, M.Pharm, PhD, who is currently serving as Associate Professor and Head Department of Pharmacy Practice, JSS College of Pharmacy, Mysuru. Dr. Shilpa is an alumnus of JSS College of Pharmacy and began her professional journey in medical writing before moving into clinical research as an executive at Strides, Arcola, Bengaluru. With over 18 years of academic experience, she has made significant contributions as a clinical pharmacist in respiratory medicine, mentoring and guiding students and researchers for more than 20 years. Her research interests include quality of life, studies in asthma and COPD medication adherence, drug allergy, and metrovigilance. She has been actively involved in coordinating clinical trials, including phase 2, phase 3, and post-marketing surveillance studies. Dr. Shilpa has represented her work internationally, receiving travel grants from the International Society for Pharmacoepidemiology to attend conferences in Czech Republic 2018, Japan 2019 and 2024, and Denmark in 2022. She has presented numerous papers at national and international forums and was awarded Best Poster Presentation for her study on the self-decision model and its impact on inhaler medication. In addition to her academic and research achievements, Dr. Shilpa serves as Chief Editor of the ERP News Bulletin and is an active member of both the International Society for Pharmacoepidemiology and the Indian Pharmaceutical Association. We are honored to have Dr. Shilpa Balakrishnan, the study and the resource person of the pharmacology program, and we look forward to her valuable insights and expertise on principles of prescription and medications. I now hand over the stage to you, ma'am. It's all yours. Welcome you, ma'am.
Thank you so much. I'm very happy to see all you students here, and pharmacy and nursing should work together. We are all healthcare professionals. We are a part of the team. So it's nice to talk to you about prescribing. As Sir was also mentioning, the doctors mentioned about how pharmacy or how prescribing has a lot of influence, and especially when it comes to different aspects. We just say prescribing, but it has many factors to influence. It has many things which can alter it, ultimately which will be leading to a patient safety problem, or it can have an efficacy, or it can bring down the efficacy or cause a harm to the patient, depending upon what way we prescribe. So prescribing is an important tool, or prescription is an important tool, which we have to look to when we are treating the patients. Though in Western countries there are been eligible or nurses and pharmacists both are having prescription rights, especially when we talk about pharmacy. They have prescription rights for only minor ailments, and even though Western countries, many of the medications are managed by the nursing practitioners who play a very important role in the primary care centers, and during their routine checkup, it could be diagnosis, health monitoring, or treatment planning. They have a vital role to play as a team member of a healthcare community. The extent of their respective authority, as it would be a right for them, or it would be a quality or qualification which is required. The prescribing medications independently, they could look after, especially under the supervision of the physician, and they are only permitted to transcribe of prescription. Transcribing of prescription means the original prescription is always written by a registered physician, okay? A registered practitioner, we say. This prescription is defined as itself as it is a recipe which is written by a registered practitioner. A practitioner can be a general physician, surgeon, or a dentist, anybody, but he or she should be a registered and qualified practitioner. So as a nursing faculty, we have all the rights to transcribe it. Transcribe it means maybe we have to write, or we may have to indent for the drugs which is prescribed by the physician, or we may have to ask the patient to bring it, or we have to translate the same thing which is written in the consultant sheet to the treatment chart, or from there to the prescription, or during the discharge summary. So these, when we write it, then we call it transcribing. We are not prescribing, we are transcribing. Whatever it is written, we are writing it in the other format when it has to reach the patient. Okay. So granting full prescribing authority for the nursing practitioners will always have a helpful hand in delivering more efficient and accessible healthcare. And sometimes, particularly in the rural areas where physicians are very scarce, their nurses play a very vital role in both prescribing, transcribing, and also helping out in bringing the outcome of the health prescription. So prescription authority for the nurse varies from different states to countries. Some they are being fully independent of prescribing, and while others require physician supervision. When we talk about Indian scenario, as I said, it is only the registered medical practitioners are legally authorized to prescribe any medication. It could be part of your allopathic medication or an Ayurvedic medication, and it comes under the National Medical Commission Act 2019. Okay, so this act usually gives the license to the community healthcare providers to prescribe under the supervision or restrict their numbers, especially under the licensed medical doctors. So here, the clinical judgment when they take or diagnosis when they do, nurses also be a part of that, where they help them in prescribing, not only transcribing, but also administering the right drug to the right patient at the right time. And any mistake, even during this process, is considered as a transcription error. Okay, so I will just tell you, let me just start with the prescription, what you exactly mean by a prescription. And there are different parts of the prescription. Like how you have different parts of the body, we have different parts of the prescription. Okay. So the first thing you can see, always there will be details of the prescription. It could be hospital details, it could be private clinic details, the phone numbers, the contact numbers, the date, the address, all those things are usually mentioned in the top of the prescription. Okay, there it is very necessary nowadays. Even the medical commission rules are there, wherein the doctor's registration number have to be mentioned, the date have to be mentioned. Okay, then the demographic details of the patient. Demographic details means what is the age of the patient, what is the gender of the patient. Okay, so because every prescription and the dose strength, as you will be understanding, as you are now learning pharmacology, when you learn pharmacology, you also learn about the dosage, isn't it? Those forms, isn't it? You know there is different forms like injections are there, solid dosage forms like tablets, capsules, suppositories. There are all different types of drugs forms, isn't it? Dosage forms we call them, and different route of administration. You know, we have IV, IM, subcutaneous, we have intrathecal, we have, correct? So there are different forms, and not all the formulations or not all the strength and not all the way of administration holds good for every age of the patient. That means pediatrics, we have a different thing to go. Pediatrics, it's a different dose to go. Adult, it's a different. So when you study your pharmacology for any drugs, if you study, you will be studying adult dose and pediatric dose. Right or wrong? Yes? So it is very important. That's why the demographic details of the patient is very important in the prescription. It gives the identity to the prescription. So any drug which is written to the adult cannot be dispensed or cannot be given to the child. Okay? Because the dose is different. You also understand many of the pediatric doses are only framed on the either the body weight or the body surface area. As sir was mentioning about the oncology drugs, you said that you know about chemotherapeutic drugs. Chemotherapeutic drugs are always calculated, dose is calculated based on the body surface area. Okay, so body surface area means it will be different because it depends upon the height and weight of the patients, BMI. Okay, so the demographic details of the patient to whom we have prescribed has to be mentioned in the prescription. That's an important information which should go there. Then you always, I think whenever we start the prescription, you have always seen this particular symbol. Yes? What is it? What is it actually? We always say it is RX. No, it's not RX.
Treatment.
Huh? Treatment. No, what exactly is those? No, what are those alphabets? Here itself it is written only. It's R and J. Okay? So what is J? Stands for Jupiter. What is this planet famous for? Known for? So earlier, whenever they used to prescribe medicine, like how we pray to God, we live the land today. So the Jupiter is stands something related to the health issues and medication prescribing. So we are praying that whatever we give, the recipe is a list. Okay? So whatever we are giving should be helpful to the patient whom we are treating. So that is what it exactly stands for. Now you know how important is that? Okay, so that is called as superscription. That particular writing is known as superscription. Basically, as you said, it means the recipe, and when we have written the recipe, we have taken the permission or blessings from the God. Now, why did we call this as a recipe? Is earlier days when the prescription was written, we had lesser pre-packed medications. What do you mean by pre-packed? How do you see now medications available? You see everything is in a strip form, packed neatly, either in the form of capsules or tablets, or even if it comes in the powder, it's neatly fixed in the vials. Correct? They are all pre-packed medications. But earlier days, it was not used to be, many of them used to not be the pre-packed. That's why we had two terminologies coming there. One is called compounding and dispensing. They are two different things. So earlier pharmacists used to be called as compounders also. Now you call them, they will all laugh at you. Okay, they don't like calling compounders. Okay, so there are two different reasons why these two different terminologies are there. Compounding means where you are mixing the ingredients according to the need of the patient. Okay, so when you nowadays you say syrup, isn't it? Earlier syrup used to be available as such. If you see some older movies, you will see all big glass bottles used to be there with different colors of solution. So once the physician writes a prescription, it is brought to the pharmacy where they will mix it, okay, according to the requirement ratio, whatever it is, and then make it into one bottle and give. So that is compounding, and if you are giving it as dispensing. Okay, so that's why earlier the word came with recipe, because you have to cook, you should know what are the ingredients. Then only you know how to cook it. Okay, then you serve it. So it's a recipe. So here also it exactly means that. Okay, so then we have another part is the inscription. Inscription is whatever we are prescribing. The drugs we are prescribing with its strength. Okay, strength in the sense. If you take paracetamol, what is the strength of the paracetamol? What strength of Dolo? Huh? 650 mg. What is the regular dosing dose? 500 mg. Correct? The strength is different. Okay? So the drug along with its strength is usually mentioned. The units are very important. Mg, microgram, nanogram, ml. Okay? Units. Some of them are even units. Your IV insulin is given in what dosage? What unit? Units you use there. 8 units, 10 units. You don't say 8 ml, 10 ml. Okay? So units is very important. So when you mention the drug name along with the strength and list what the patient is supposed to take, that is the main content of the prescription, and it is called as inscription. Okay? Then we have something called as subscription. So you can see there the word subscription. The subscription is the instruction to the pharmacist. Suppose, as I said earlier, we used to mix things. So we have now what the instructions to the pharmacist there, how much of it is required. For example, you were talking about antibiotics. So if it is for 5 days, 10 days, the pharmacist has to calculate it is for how many days, how many times a day, and then dispense the medication. Or there also will be something below that, what these also give instructions, special instructions to the patient, where when to take the medication, before, after the meal, or before the breakfast, or you take it in the night, in the morning, 3 times a day, once a day, or only at night. Okay, different ways of prescribing. So all these information have to be present in a prescription. Then after that, refilling is very necessary. You all know that nowadays, I think even at home we have an old prescription, we go to the pharmacy, we get the drugs. Right? Somebody at our house was having fever and the doctor had prescribed the medication. Mom had fever, she had got the prescription. 2-3 days later, father also fell sick. Same prescription is used there. Correct? Or if mom has not taken to save the money, if she has kept the medications like that, the same thing she will give to the father also. Maybe child also. What she will do, she will break. Oh, maybe I should not get it. Is it correct? No, it is not correct. Okay? So that's why refilling date is very, very important. And there are some category of drugs, for example, your psychiatric drugs, okay, which are having so drugs which are having low therapeutic index, or you mean to say which are high alert drugs. Okay, so these kind of drugs we cannot have any kind of refilling date without another prescription from the physician. So that date is very important. And then we call it as signa, where there is directions to the patient. That is signa. Signa is not signature, it is the direction to the patient. When to take it, how to take it. Okay. And then the patient, the signature of the doctor and the seal if it is available, and the date when the prescription and when it is signed. So these are the different parts of the prescription. So the first fundamental for you to understand is how a prescription is going to look. What are the different things should be mandatorily, legally present in a piece of paper which is called as a prescription. Okay? Is it clear? So some legal and ethical issues, because prescribing, when we are prescribing, transcribing, or we are administering, we are taking care of a life, isn't it? It's very, very crucial and ethical also, because we are looking after the patient. Whatever is happening to the patient, we are equally responsible for that. So some legal and ethical issues are there which is related to the prescribing. First is standing orders. In some sectors, certain physicians are allowed to write the standing orders, like prescription for everyone in the public. And sometimes they have to give it in a standard procedure, which is how it should be really. How the exact way of prescribing, the physician should write the prescription properly and give it to the nurse. Okay? Sometimes what happens in the emergency conditions, when you are at the night call or the doctor is not there, there's an emergency call, you call this physician, you ask them what to do on the call. There, the doctor will tell you to prescribe these kind of medications. So what you should do, you should record it and keep, but always that prescription should be rewritten by the physician and signed. Maybe he comes today night to a call at 2 o'clock, he will be available by 6 o'clock in the morning. No problem, the standing instructions what he has given, he has to write it and sign it. Okay, so that is a legal issue. And then handwritten prescriptions, because illegible handwriting, you all say, what you have written like a doctor, you all make fun, right? What is this doctor's handwriting? You don't know how to write. You have not been taught about cursive writing. See, everybody is sleeping. Am I boring? Everybody's hands are on the heads and somebody is sleeping. If you feel boring, you let me know. I will not show the slides. I can talk to you like that. Am I audible to everybody? Am I talking something sense? Yes? It's really going to help you in your career. It's a very important. You should always remember to safeguard yourself and your profession and the patient safety. Okay? So, if you have any doubts also, you can raise whenever you want and let me know. So, some of the handwritten prescriptions, which is what thing which is bothering here is always the illegible handwriting. Because some practitioners have a very vague kind of writing, or they are in a hurry. Sometimes they miss decimal points, sometimes they miss the units. So handwritten prescription is another medical legal document. It's a medical legal document actually. So it has some rules which is set. It says it should be written in the capital letters, and the prescriptions are to be written in the generic names. What do you mean by generic names? Generic names and brand names. Are you aware of that? What is the brand name for paracetamol? What's the brand name for paracetamol? I think in COVID era you should have heard it so many times. Dolo? Dolo is a brand name. Paracetamol is a generic name. Okay? So whatever the active ingredient is present in the medication, we call it that as a generic name. Okay? Gentamicin. It's a brand name or generic name? Generic name. Okay? Amoxicillin. Moxiclav. Moxiclav is a generic name or brand name? Yes, very good. That means everybody is aware. Thank you. Okay, so that is very important, that the legibility and understanding, the way of understanding, and it should be written in capital letters, it should be written in generic form, and it should have a proper strength and units mentioned in the prescription. That is very, very necessary in the prescription. Okay, rational prescription. What do you mean by rational? Have you heard about rational use of drugs, medications? Anytime? I think your first chapter with general prescribing or general pharmacology should somewhere reflect on rational use of medicine. So you should remember the different rights here. Right drug, right stand, right time, right patient. Okay? And that is the right time you give. All these rights are the rational use of medication. That means simply to say that the right medication reaches to the right patient at the right time in the right dose. Okay? So you cannot give whatever dose you require to the patient. If he is an adult patient but he has different complications like renal failure is there or the liver function is dysfunction is there. So every drugs cannot be given there. You need to either administered in a lower dose, or you have to calculate the dose depending upon what are the comorbidities present in the patient. There may be requirement of even some contradictions which really you don't have to use them in those kind of patients. So right drug that it exactly means. So medical negligence, so it is what the harm is caused to the patient by the medical practitioner. So that is usually called as medical negligence. It could be because of prescribing, transcribing, dispensing, administration. It could be because of anything. Okay. So also you should remember, you should avoid certain ambiguity. That means prescribers must follow certain conventions for writing a prescription to avoid any kind of misinterpretation or confusion. So that is careful use of decimal points. See, even if you have missed writing 5, 0, and if it actually is 5 ml, but you want to write it as 5.0 ml, you have missed that dot, it becomes 50 ml. It's 10 times the dose you have given. You imagine, instead of giving 5, you have given 50. Okay, so writing the decimal points, sometimes 0.5 ml. If you don't write this 0 and the dot is nowhere visible, then it's 5 ml, it's not 0.5 ml. Okay. Then use of apothecary system, as I said, when you use pens or you use zeros, so it's always confusion. So we have to have very legibly writing all these things. Then directions written out in full in English. Sometimes it may be not visible, advisable to do that. It may be depending upon the understanding of the patient or the way you are exactly practicing. Then there are the directions as needed. So the quantity should be mentioned as needed, SOS, or when required. So all these abbreviations should be correctly used. Then always use a permanent ink, because always it can spread or can disappear depending. You don't use pencil to write a prescription. You always can erase and it can cause lot of errors. I think ma'am will be talking about medication errors. You may be telling it that. Okay. So use of forms like teaspoon and tablespoon. So in your house, a tablespoon would be like a teaspoon. In somebody's house, teaspoon would be like a tablespoon. Okay. We don't discriminate it. We are not really into the British era when we keep all those small, big dessert. There is teaspoon, tablespoon, dessert. 3 spoons. You know that? Table and dessert. 5, 10 and 15 ml. That is how it is denominated. Okay? So instead of that, nowadays it's very easy because all the syrup or all the liquid formulations do come with a pre-printed cap, isn't it? The mark, it has a demarcation which easily gives you this 5 ml, 10 ml. So prescription also should be written in the form of 5 ml, 10 ml, 15 ml, not in the form of teaspoon, tablespoon and dessert spoon. Okay? Then the degree symbol should be used, especially when you are using for aspirations for hours you are maintaining or anything which can lead to further confusion. So this is just a prescription for an example. Can you read it? I think I have 3 or 4 prescriptions in one slide. Yeah? It's so difficult, no? I think we should give a writing class to this. So, this is how the illegible handwriting could lead to different causes of either interpretation error, leading to different aspects of patient safety. And when you don't follow what is supposed to be there, see, nowhere the whole part of prescriptions are there. The first prescription, what I showed you, nowhere that kind of information is there. Correct? So this is one of the examples for such kind of eligible prescription. This slide. Yeah, this is another treatment chart prescription. You can see 3 people have signed there. You see? 3 people have signed there. So how as a nurse you will dispense or give the medication? One doctor will come, he will write something. Other doctor will come, he will write something. Third person will come, he will write something. So until and unless you know, understand, you have the knowledge or clear understanding between you and the physician, never go for administration. Clarify it then and there, and then only. So this prescription shows 3 different attending doctors giving 3 different instructions on the treatment consultation sheet. So this is one of the errors in printing prescriptions. You can see errors can be made in different forms. You can see similar spellings or pronunciation names, especially we call that look-alike and sound-alike drugs. Okay? So they would either look same or they can sound in the same way. They have the same pronunciation because they are not Greeks. We don't really follow the Greek accent. So when we pronounce certain things, it would similarly sound. So we have to be very careful in that. So you will see Inderal, Adderall, Zyrtec and Zental, Celebrex and Cervex, Kutsar and Prozac, all they have a similar names or sounding names which can confuse you, and if it is not written in properly, it can lead to a dispensing or administration error. Can you move on? Yeah. Some of the ethical issues, the treating doctors and the other healthcare professionals should have certain ethical principles mentioned. Respect to the autonomy. So adult patient who is mentally sound or cannot make any decision regarding his or her health or treatment, their informed consent should be taken before diagnosing or prescribing to anybody. And the principle also explains that it is basically meant to not have an intentional harm or injury to the patient done either knowingly or unknowingly. And benefits means the health professionals should also be active with the patient benefit. Physicians must treat all the patients equally and fairly. So this is some of the ethical issues which they should consider when they are really planning the treatment. Then some of the other instructions, like all prescribers should be clear about the reasons for prescribing. As sir was mentioning, antibiotics. Nowadays, you've seen antibiotics. They not even go to the doctors, they may come to pharmacists or nurses. They have severe cold cough. Until and unless you give them an antibiotic, they will not go. They will say, yeah, they will say, patients will say. When they come to medical store, they will say, next time. So what happens? My business is gone, my practice is gone. Correct? So what we do ending up? We give antibiotics. But that's not true. You should not do that. That's not ethical. Okay? Until and unless necessary, you know that there is a necessity of giving antibiotics, only whether it's a bacterial infection or a fungal infection or a viral, sorry, not viral infection, any other pathogenic infection, then you can give other antifungals, antimicrobials, depending upon that. If it's a viral infection, then better to prescribe the antivirals and not the common antibiotics. Okay? So, because now world is facing a major issue with this last is antibiotic resistance. Okay? We are losing these, we can say that the germs of the treatment, because everybody is getting resistant to even the newer antibiotics, higher antibiotics. Then how do we save the life of the patient when we cannot use such kind of drugs to them? Okay. So consider the factors of the previous medication history before prescribing, because they may have allergy to some of the medications. You always have to check with that. Consider factors like any kind of benefits and risks to the patient. Is patient allergic to others? Suppose patient is an asthmatic patient and you give some NSAIDs. So that is actually not right. Okay? Then select effectively safe or cost-effective medications you have to choose. Right medications you have to choose. Choose it from the national guidelines and local formularies. That's what sir was saying. Only write the drugs which are there in the pharmacopoeia. Okay? So then write, and that means whatever I show, the error-less prescriptions you should write and correctly document it and monitor for the adverse effects. Because even if you write correctly, take the medication correctly, there's always chance for adverse effect. It's not anybody's fault, neither the doctor nor the nurse, and any drug can cause adverse reactions to any patient at any time. So fundamental principles of prescribing. So be clear about the reason for prescribing. So what you are prescribing, what is being prescribed. When you are transcribing, please review it and transcribe it. And consider the patient medication history, as I said, because patient would have already had an allergic reaction or an adverse reaction to this particular drug, which he may not understand, but when you ask and then prescribe, you also come to know. So it is very necessary to play a very important role in the doctor-patient relationship as a healthcare provider, and also try to enlist, recruit, involve the patient in the collaborating their prescribed medications, because they will be knowing something more than what you want you to know or when you have asked. So they themselves sometimes hale yogi, to say old patient is better than the new doctor. Okay? And because the patient knows what he is taking, what happens when he takes it, or when he is supposed to take, when he is not supposed to take, because he has taken it from quality. Okay? So always involve the patient when you are planning the treatment. Then consider other factors. As I said, you have to consider the comorbid conditions very importantly. If they are pregnant ladies, lactating mothers, all drugs cannot be given to the pregnant women and the lactating women, because they will cause the discomfort or the disformity in a fetus, an unborn. Okay? So pregnant, that's why many of the drugs, when we are prescribing the pregnant woman, we check whether it is safe or not. There is a whole lot of classification on pregnancy and lactation drugs, which is classified based on the safety. Okay? So we have to take care of that. If they are being impaired kidney function, liver, heart failure, and also you have to prescribe according to their benefit and risk. Check whether it's having higher beneficial than going in the risk in that particular patients, and also consider the expectation, what exactly we are treating when, or what is the outcome which we are measuring when we are prescribing the medications. For example, we can combine some 4 or 5 drugs are there. Sir was saying we have seen so many patients taking handful of medications, correct? So what happens when there are many kind of FDAs, that is fixed drug combinations are already available, it is safer, it doesn't have an interaction between them. So when you use these kind of combination of drugs, it will minimize the number of medication the patient is consuming physically. Physical number will be reduced. That will help the patient, and also sometimes it may be cost benefit when you are giving the FDA. But there may be pros and cons which we have to say. That's why we also should check it before we give. Cost effective medications, very importantly, there are brands available which is having a higher cost, the same medication is available in the lower brand, which can be feasible for a patient to take. Always try to check in and use those for the optimal management of the patient. And selection of medication, prescribe medicines that are especially when you are prescribing the off-label or out-of-standard medication, you have to be having a very strong decision-making evidence when you are doing that, and choosing the best formulation, dose, frequency, route of administration, and the duration of the treatment. So all this should be there in the prescription. That's why I showed you the first prescription. Every written alphabet prescription has its own value, which you should honor it and take it carefully to see that. Okay, so adhere to the guidelines and national formularies or local formularies. This hospital will have its own formularies, so you can adhere it to that, or you can follow the standard treatment guidelines which is there, which is given from a different standard authorities. Okay, so that can also be, you can use it when you are thinking about prescribing the proper medications to the patient, especially if you are working in a hospital. Try to match it with the selection process of the formularies, which is based on that. The prescription should be written, and also guide sometimes. That's what I'm saying. When you write the units, milligrams, nanograms, micrograms, you should be very careful in instructing those things in your prescription. And you should be aware of common factors that cause medication errors, and you should allow to help them. Especially when we use short forms, it is very important that we should be a standard abbreviations and not some short forms what you have been. Okay? So monitor the beneficial and adverse effects of medicine. As being a pharmacist, I also want always you being a healthcare professional. When you prescribe or administer, your work doesn't end there. You also have to follow up the patient, monitor the patient, because adverse drug reactions are something which can happen to anybody at any time. Monitoring, assessing, and they can also giving the strategy to overcome it is very, very. Apart from that, documenting these adverse reactions are very important. You have to be part of the pharmacovigilance program, which will help in identifying such incidences and letting us know that yes, these drugs can also be causing any other reactions other than what is being listed. So steps in prescribing, I have already told this in you can go to the next. Okay, so just to brief out, so you should know the problem of the patient, specify the objective, choose the standard treatment, verify the suitability, and then start the treatment. Give the instructions very clearly and warnings very clearly. Monitor and stop the treatment whenever it is necessary. So that's the same thing which is being described here. And what are the components? So always understand the needs of the patient. I have been telling you, always ensure what the patient requires is treatment, what depending upon the medical history, comorbidity, whatever it is, only then you take up the medications to be prescribed. Follow the guidelines which is been there in the scope of your practice, review whatever you have written, interpret the same thing to the patient, and also see that the same thing is reaching to the patient as a treatment plan. Always review the diagnosis before you start the treatment, and discuss the person clinical issues, especially with the patient, and involve them when you are treating the patient. So recognize it, so understand the management option. While recognizing and management is very important, because sometimes major errors occurs at this place when, as you can correlate with drugs having similar names, and when you don't understand for what reason the patient is being prescribed, you also don't check, or you will also not try to understand why those confusion of the medication were given there. You can just be ending up giving any medication because of the confusion. If you have understood what is the diagnosis, if you have understood what is the need was there, then you will also be able to do some interventions. Interventions means where necessary changes in consultation with the physician, you can can bring the notice to the physician saying that the medication is not definitely written or it is been wrongly, and sometimes it can be dispense error because of the same confusion. So somebody has dispensed it wrongly, and when you know that this is not the medication to be given to the patient, how you know? Because you know the diagnosis, then only you can make the judgment. So always understanding the management options is very much important. Then agree on the plan of medication. So everybody should be on the same page. That means you, the physician, the nurse, the pharmacist, or any other healthcare professionals who are there in the team, they should be understanding the patient or patient-related details in the same manner. There should not be any confusion. And also you have lot of chances or the platform to interact with the patient, because many of the patients, especially in our condition, we know that they end up in self-management. So your instructions and your role plays a very important role there, and then only you can help the patient. So making them a partnership with your treatment goals. Okay. Then prescribe the medicines and communicate the agreed decisions carefully. So while prescribing, that's what I was saying, giving you an example, whether if it is an electronic prescription or you have used a telephonic device to have the guidelines done by the physician. Make sure you have legible in return. You have always had clarifications done with your physician before you have written the prescribed prescription, given the prescription for taking the medication. So you have to make sure it is accurate, complete information is there, timely it has been implemented, and any modification required should be done on time. So everything should be noted down well in the treatment chart or in your prescription. Okay, so review the outcome. So that's what I was saying. You have given, the prescription is given, patient has brought a medication, you have given the drugs, your role does not end there. You should know whether the patient is really getting benefit or not. Even after 5 days of antibiotic given, patient is not stabilized. That means you should understand that this antibiotic is not working in that particular patient. You have all the rights to inform the same thing to the physician who is with you, saying that we have already 5 days of administration is done, but still patient is not getting better. Okay, so you should know, you should review the outcomes of the treatment. So if unnecessarily medications are given for 7 days, 10 days, a patient's day off is increased, the economic burden is increased, patient is exposed to unnecessary dumping of the medications into the body. All these have to be monitored when you are doing the planning for the patient, because you play a very, very important role in the patient safety and outcome. That's what it says, prescribe safely and effectively. So legislative framework, you should always be following it up. You should understand what are the common causes of incidents or errors which can be associated. I gave you some examples, decimal or writing the same kind of sounding names, or it could be in the MCG or MG. If you don't write MCG and you write MG, it becomes microgram to what? Milligrams. Okay? So if some people write the symbol of the microgram. If you mistook it for M, then it is a error. So you should be very careful, legible, understand what you are prescribing, what is being prescribed, what is being given, why it is given, what is the patient is suffering. So prescribe professionally. So ethically think whether it is required in the patient or not. Unnecessarily adding up medications. Can it be non-pharmacologically also maintained? Okay. The fiber diet can always improve his constipation rather than giving another drug for his constipation. So in that way, you should professionally think and provide the necessary prescribing decisions. So I hope I have given some inputs which you can take it as a key message. Anybody any has questions? I'm open. I hope I did not bore you. Did I?
Thank you so much, ma'am, for your insightful and well-structured presentation on the principles of prescribing medication. Your clarity, depth of knowledge, and practical examples truly enhance our understanding and made the session highly meaningful. Thank you so much, ma'am. Now, I welcome our dignitaries to felicitate Dr. Shilpa.